Paul, I want to thank you today for coming in to tell us a little bit about your admission, which was last May, when you had bariatric surgery. And can you start by telling us a little bit about what life was like before you came in?
It was horrible. I was literally dying. You know, I was housebound for 4 years, bedbound for probably 2 years, and I could feel myself getting worse. So I rang the doctors, I asked for a home visit, and the lady said, "What's the problem?" And I just said, "Everything, I'm dying, I need help." Fortunately, the GP came out that day. He put me in touch with Dr Gillespie and a lady called Fran Lane, who was a nutritionist, and it all started from there really. It was a long 12 months to get to the part where I was admitted, but it was rough.
Dr Gillespie, now, that doctor, is that a psychologist?
It's the clinical psychologist, yeah.
And what did they do? Did they help you sort of prepare for the
the Fran used to come out every couple of weeks. She used to bring a set of bariatric scales with her, which maxed out at 300 kilograms, which wouldn't carry me for about 5 months. Dr Chris used to come. He used to come around and talk to me, try and get me mentally prepared to go outside, you know, walk about, and yeah, just try and improve my quality of life before we was ready for surgery. So
when was the bariatric surgery mentioned to you? When was it brought up?
It was mentioned the day the doctor came out to see me the first time.
Yeah,
you know, he said that the only option really is to look at surgery because you're in a really, really severe case of obesity, and your health and your life is really at risk. I was having home help. Carers used to come once a morning just to get my day started.
Yeah.
But it was mentioned pretty much straight away.
And so then you met your surgeon?
Yeah, Dr Sherif Awad, he's the genius. He's saved my life, most definitely.
Our team got involved in Paul's case following a referral from his GP. And his story is heartbreaking, really. He was referred to us as a 35-year-old who, in essence, was housebound. He weighed 315 kilos, which is the equivalent of 50 stone, at the start of his journey. And he'd received a number of years of community dietetic help and intervention to help him to lose weight. And in essence, Paul was imprisoned in his own body, imprisoned in his own house, and we decided that actually he was an individual who deserved the help from the hospital and EMBMI, and he certainly became a very special case within our service because he was the heaviest patient that we have treated as a bariatric unit, and there's only a handful, 2 or 3 units in the country who would have the expertise and the facilities available to be able to treat somebody of that size, somebody who weighs 50 stone and who's unable to leave the house because of their weight, and somebody who has an exercise tolerance in essence of around 50 yards, following which he'd have to stop.
What sort of treatment did Paul have?
So obviously taking somebody like that and bringing them out of the house for the first time into hospital with a view to having bariatric and metabolic weight loss surgery is a long process. And so the whole team got involved, from me as the surgeon, the physicians, the clinical psychologists, the dietitians, the community nurses, the GP, and we set about trying to make an assessment of Paul initially to ensure that he's medically fit for surgery, his body's prepared for it, and that he is someone who would benefit from the expertise that we have here in the unit. And it involved a number of house visits, actually. So me as a surgeon and the physician and the dietitians, we would go and assess him as a team in his house. So we took 2 to 3 house visits to take his medical history, to examine him, to take a number of photographs to feed back to our team. And we came to the decision that he is someone who we wanted to give our full support to and to treat with the expertise that's available. Obviously, because he was the heaviest patient that we have treated, there were a number of serious logistical issues involved in treating him, amongst which was how we were going to get him out of the house and to the hospital, the ward and how they were going to handle the moving and handling, whether we had the appropriate hospital bed and mattress to cope with somebody who weighed 50 stone, who regularly would need turning so they don't develop pressure sores. And he also had a number of medical conditions. So he had type 2 diabetes, so sugar problems, and we had to get control of this. And the whole team came together for Paul, because they believed in the way that we can transform his life, and this was someone who was deserving of the best that Derby and the EMBMI had to offer. We made the initial assessments, and we decided to actually admit him into our specialised bariatric ward, Ward 313, and he was admitted there for a period of 6 weeks before surgery, with a plan to give him a very low calorie diet to help to shrink his liver and reduce his weight, to allow us to operate on him and offer him the planned operation, which was a sleeve gastrectomy.
You came in for your pre-op in the April, wasn't it?
That's right, yeah.
And then you came into hospital, and in total you were in for quite a while, weren't you?
5 weeks to the day.
Yeah.
Yeah, it was a long stay.
Can you tell me a little bit about that admission? Did things mostly go well?
Yeah, everything was. It tended to run like clockwork, as mad as it sounds. I mean, it was the first time I left my home in 4 years. Was the day I got admitted.
So it's quite emotional for you.
It was really strange. It was really, really strange. I mean, my friend brought me in, and we had a bit of a drive around Derby, places that I've not seen for years,
Yeah.
and it was really surreal. It was almost as though I'd been there, but everything had changed. So it was eye-opening, most definitely. And we arrived in the morning. The nurses and staff on Ward 313 were brilliant. They were really, really accommodating. So yeah, that was home for the next 5 weeks.
You found everything
Yeah,
fine?
the staff were fantastic. I was put on a specialist diet to shrink my liver and make sure I was ready for surgery.
Yeah.
There was a couple of mishaps with bringing the wrong foods in, but apart from that, everything was fine.
In terms of the treatment that he had, we had to hold a number of high-level meetings, so the hospital management got involved, the anaesthetic team were involved, the medics, the nurses, the moving and handling, facilities, the theatre managers, and all of us, we held a number of meetings to ensure that we had the appropriate facilities and the setup to allow us to operate on somebody of this size, because clearly the operating tables that we use in theatre, they only hold a certain size of patient. Often we have to change the position of the patient and tip them to stand them up when they're asleep, so we didn't know whether the table would hold that weight. Reaching to give the patient an anaesthetic when they're that size, that's a challenge in itself, and we had to put our facilities to the test. And in essence, 2 to 3 weeks into Paul's admission, we organised for a dummy run in theatre that was done on one of my evening lists. So we assembled the whole team who would be treating him on the date of his surgery that was planned for May 2016. And in essence, we treated Paul and we ran through everything so that we did a dummy run of exactly what would happen in theatre. And that was a big logistical thing to sort out, as I'm sure you'd appreciate. But in essence, the porters needed extra chairs and 2 porters to push the chairs instead of the one. And everything was tested to ensure that we were going to run smoothly on the day. And he was absolutely brilliant. With full enthusiasm and full humour, he embraced his journey. We did the dummy run in theatre and everything went according to plan, and we were all set up for 2 weeks later to do his surgery in May on one of my lists.
And then just tell me a little bit about the surgery.
We went down for a dummy run.
Yeah.
It was quite daunting, to be honest. The gravity of it all didn't really hit until the morning of the surgery, but yeah, it was rough. I believe I was down for about 4.5 hours,
Okay.
nearly on the table, and yeah, I woke up in a lot of pain, but I'd do it again tomorrow.
But the outcome was successful, wasn't it?
Incredibly.
Needless to say, it was the hardest operation that I've been involved with. Technically, it was incredibly challenging. Our specialist bariatric arranged for 2 consultant anaesthetists to be present on the list, and I think this is testament to the the willingness of the hospital to help Paul, and the investment of resources. You can imagine a consultant anaesthetist, the consultant surgeon, that's a very expensive resource to provide. And management had absolutely no qualms to provide and throw as much expertise as we could give to Paul so that he gets a good outcome after the surgery. So we ordered extra long equipment to cope with the pressures inside. And in essence, a sleeve gastrectomy is an operation that aims to remove 3/4 of the stomach and take it out of the body. And that results in weight loss of around 25 to 30% over the next 6 to 9 months as a result of the patient reducing the volume of food that they eat, and also because the operation aims to remove the upper part of the stomach which produces the hunger hormones. So that was the aims of the surgery. Such an operation would normally take about an hour. In Paul's case, his operation took almost 3.5 to 4 hours. And that was as a sheer result of the difficulty in the equipment actually standing up to the task in front of it, because Paul's abdominal wall was in essence 6 inches thick, and that it weighed a huge amount. And for the instruments that we use to do the keyhole surgery to be able to cope under such tension, we actually went through a number of instruments which bent and became non-functional during the case. And again, this was the investment that the hospital made in Paul's operation. Yeah, absolutely, it certainly was. The team worked hard together. The anaesthetists did an absolutely fantastic service. The scrub nurses, they scrubbed for the case, and it really did come from their heart. They stayed behind. We overran in the theatre. It wasn't a problem. And after the operation was done, it took 12 members of staff to be able to transfer Paul safely from the operating table onto the bed. And his care was absolutely specialised in every aspect of his journey, including his going to recovery. So we chose a specific recovery nurse who's now the lead link nurse for bariatric surgery on recovery because of the interest that she developed in the case. And Paul, during the dummy run, had come down and had met her already. So we made sure that all the staff that were there on the day of his surgery, they'd previously met him and were aware of his specific condition, absolutely.
And what happened after the surgery? What sort of things did you have to do to change?
Obviously, when you have a sleeve gastrectomy or any kind of bariatric surgery, you're very limited into what kind of diet you can go on to begin with.
Okay.
The first 4-5 weeks were really boring. You know, you can only drink
all liquidized
or
soup.
soft, or you know, there was nothing solid to eat, and it's really strange. But obviously the key, which was drilled into me from the early stages, was that you have to eat till you're satisfied and not until you're full.
Okay.
Which, when you've spent years of living off takeaways and drinking what you want, it's really hard to adjust. But I think I took to it quite well. Yeah. And the scars are good. Yeah. The scarring isn't too severe, but yeah, it's been all right.
When did you? Obviously, your life changed from that point onwards.
Massively.
And when did you start to see a big difference?
Personally, I didn't. It wasn't until after the surgery I was laid up for a while with gout in both feet, and I stood on a set of scales which I managed to buy, and I'd lost something like 25 kilos in 8 weeks. And I was like, I've not moved. How? But that's just a natural course of progression after surgery. And eventually my confidence got better, and I managed to sign up to a gym and started going to the gym on a regular basis as well. You got your
life back, didn't you?
Yeah,
really?
I'm living. I'm not existing anymore. I'm actually living now.
And you're going out now. And
yeah, I've got a fantastic circle of friends that have been there throughout everything. And even though at times they do struggle to understand where I'm coming from, they get it. And you know, I've got friends that when I was in here, they kept me sane. And even now I'm living, it's like I'm part of the group now. Yeah. Rather than the one that they had to come and visit, I can go to them. Yeah. And that's the best feeling. It really is.
Do you still have regular meetups or catch-ups with your consultant?
I had one for every 3 months, and then I seen Dr. Awad just before Christmas, and he said he doesn't need to see me for 6 months now, so I'm obviously doing something right.
Yeah, that's great.
I speak to Dr. Gillespie at least once a week via text or on the phone, and he comes out occasionally as well, which is brilliant, and he's always maintained if there's anything that I need, is only a text message away.
Yeah.
So he's been really, really good.
All in all, you feel like you've had a good
it's been fantastic.
service.
It's been absolutely fantastic. You know, some of the nurses, they turned around and said, you know, make sure you come back and see us because we don't get to see many people following the operation. So every time I've come to the hospital, I've made a point of going to see them and just checking in. And yeah, they were brilliant, from the physios to the dietitians downstairs. Everybody from top to bottom were just fantastic.
That's really good
Really
to
were
hear.
fantastic.
Paul's postoperative course was complicated by a number of attacks of gout, which limited his mobility. They've improved now. And what is really heartwarming is to see the results of the surgery, because the surgery we do here in the EMBMI is not purely to help people lose weight, but also to help them get rid of a number of serious, life-threatening, obesity-related medical problems. So within a few weeks of the surgery, within a couple of months or so, Paul got rid of his diabetes and he no longer required treatment for it. His mobility improved, and he turned from somebody who was unable to leave the house to now somebody who goes to the gym 6 times a week. That's better than I. He is somebody who has now attended christenings, who referees 5-a-side every Sunday, and he is just enjoying life.
Is there anything else you'd like to tell us, Paul?
Just that a lot of people tend to suffer in silence with obesity, and it's something that needs tackling in a big way. And it's not just in hospitals, it's in life in general. There's a very serious lack of education in there.
Yeah.
And if I'd have known now, you know, if I'd known back then what I know now, my life would never have got to that point.
And are you still, at the moment, continuing to lose weight?
Yeah, the weight's
gym?
gradually coming down. I'm 21 kilos down since the turn of the new year.
Yeah.
I'm going to the gym 5 times a week for a good couple of hours each time, and yeah, I never thought I'd say it, but the gym's my happy place now.
Really?
You know, I'm there.
And are you eating normal meals now, but in smaller quantities?
Yeah, I can eat whatever I like to eat. There's foods that make me ill.
Yeah.
And they say these aren't good for you, not to eat them, but as ever, if you're told not to do something, you're going to try it.
Yeah.
But it's a learning curve. You know, I've learned what foods I can handle, what I can't.
Yeah.
And obviously my portion sizes are dramatically reduced, but I'm never hungry.
Yeah.
I drink plenty of fluids, and you know, it's about learning how to cope and how to get along after the surgery, because it is life-changing. I mean, I didn't realise how severe the surgery would be until I had it, but I'd do it any day of the week again, because I've gone from existing to having a life.
Yeah, of course.
You know, I'm planning trips away, I'm seeing friends, I'm socialising, and that's something I never thought I'd do again.
Yeah, it's an amazing story.
Yeah, you know, it's about 23.5 stone gone in under 2 years now, so we're doing well.
I'm really, really pleased.
But there's a long way to go, and I'll get there. You know, the support network has been phenomenal, and I owe my life to the people that have helped me. That's the bottom line.
Yeah.
You know, they've done everything. So
I really want to thank you for coming in today.
Not a problem.
And as I say, just keep up the good work. You're doing amazing.
Well, it's too late to turn back now.
Yeah. Oh, thank you, Paul.
Not a problem.
Well, I think people like me and my team were in a really privileged position to be able to treat patients with obesity. And it is a service that gets put in the limelight. There's various opinions as to whether obese people deserve to be treated by means of surgery on the NHS. And I think the shift has shifted, the focus rather has shifted over the past 5 to 10 years to move it just from purely being considered as obesity and weight loss surgery to more of a metabolic operation, which helps in a number of ways all our patients. So the way I look at the surgery, it isn't a lifestyle operation. This is an operation to help prolong people's lives, to help get rid of a number of serious medical problems that are draining the resources of the NHS. And the surgery in itself, along with the expertise of the team, the follow-up of the team, the resources in being able to provide such an operation, the surgery ends up being cost neutral for society and for the NHS within a couple of years or so. And the benefits to our local CCG, Clinical Commissioning Group, and the local population of being able to provide this service is absolutely second to none. And it is, the hospital is proud of the bariatric service, but equally we've worked hard to be able to deliver such complex, safe surgery. And often, for example, our mean length of stay after a gastric bypass or a sleeve is 1.5 days. Patients are out of hospital the following day. They are up and about within a couple of hours of the surgery, and often someone can come in with very poorly controlled diabetes and leave the hospital completely off their diabetes medication. And in terms of an investment in our society and getting the most for our Derbyshire pound, for example, this surgery is absolutely second to none in achieving the benefits to the individual, to the community, and to the society. And we're very lucky to have the support from the management and the chief executive of the hospital to allow us to continue with the service. We need the support of the CCGs and our GP colleagues to help us keep the service going in light of all the funding changes that are happening at the moment in a stretched NHS.